use that, what I'll do is I'll place the clamp here, and then I will use it to mark in the, so. All right, so we're going to place this needle here over the sacroiliac joint here on the right side for the patient. We'll use some cold spray in advance. Spray. And we're going to use some numbing medicine here. Crunch. Little sting. Adjustments here. You're going to mark again here on the contralateral side here. Perfect. A cold spray here. Perfect. And a little pinch. Little sting. And get another picture here. If I need to make a subtle adjustment, just going to advance a little bit more right into that joint. Perfect. So I'm going to put the cells in here now. The sacroiliac joint. Yep, anesthetic. So those were the two sacroiliac joints that we just injected here. I'm going to get to the facet joints here. So I'm going to place this here right where we would have the targets that we use for the nerves to innervate the sacroiliac joint here. So we'll go to the sacral ala at S1. And then we'll do that same thing on the contralateral side as well. Little pinch. Little sting. Just advance a little bit more. Perfect. All right, now I'm going to place some cells here. Do the same thing here on the contralateral side. There's some cold spray. Help numb them up. Little pinch with the needle here. 1, 2, 3 pinch. A little bit of anesthetic going in. Sting. So I'm going to slightly advance here a little bit. Move this out of the way. I'm going to take another picture. Perfect. And then just come down. Make contact with that sacroiliac right there. Perfect. Placing cells here. So I'm going to come up to L5. So I'm using cold spray there. I'm going to come down here, anesthetize, a little pinch, and then a little sting. It's always the worst part because they're not numbed up yet. So the numbing medicine stings. It's acidic in nature, but so once that sting goes away, you'll be numbed up. So slowly advance here. Just back up a bit. Make a subtle adjustment here. Right down to that space. Right there. Perfect. All right, I'm going to place the cells here. So I'm just using this as an anatomic marker here on the skin. So I have an area where I know I'm entering, and where I enter the skin isn't always right where the needle would go for the depth of the skin. So I'm going to be coming down, pinch in a sting, and going medial or towards the spine. At that angle here. Little pressure there. Perfect. We get a little bit more pressure here. Excellent. I'll come down right in that space right there. Right. So I'm going to place the cells here. Then we're going to have to reposition the machine here to get to the next levels. Parts. All right, we're rocking. So back on track. So you have the other. So here's the other wheel. All right, so we're going to get here, marking for the L4. As he's breathing, it's migrating, so that little pinch and a little.
Good job. Make sure you're breathing. Breathe.
It's good to be breathing. All right, I'll get this out of the way. Now I'm going to advance the needle here and just see where my current point is. So I'll say with that here. So it started a little bit more inferior as he was breathing. That migrated down, but I make the adjustment with the needle. You're doing great. We're almost done here. So we're going to do the same thing again on the contralateral side. The one nice thing about doing this side to side is you're using the other side as a landmark here too. You could cold spray that. so I know exactly where I was, and then you know what the level above and below is here for each. Little pinch, 1, 2, 3, and pinch. And a little sting here. Give another picture. Good. So here, it's going to come in a little bit more towards the spine and come down a tiny bit. So use the physics of the needle here. So we get a little curve, so I don't have to back the needle up, and I got right to where I want it to be here. So perfect. So we're going to inject this spot, and then after that, we only have 2 more to go. Put there. Whole spray. That's good. And then a little pinch and pressure, pinch. Just some pressure, numbing and stinging here. Perfect. Make the adjustment here. Come back down. Perfect. A few more millimeters here. Perfect. Excellent. All right. Just one more to go. That's going to be on the other side. Last one here. You will pinch. Just you sting. And sorry that stings there. You erase that numbing medicine here. Make it feel better. Perfect right there. All right. Last one, and then we'll be done here. So we're able to get some multiple spinal levels here from L3 to S1, as well as bilateral sacroiliac joints. Great. Now we'll just clean off the patient and place adhesive bandages on her.